Self advocacy can help the individual to speak up for themselves and get their rights heard and their voice understood and what they want to say. But it also works really well with a group of self advocates where we can all have a voice heard at the same time. More voices is better than one sometimes.
The Geordie Voices has been absolutely amazing, and it's been engaging a lot of people.
You need to speak up to people to get your point through. Self-advocacy is important because you speak up for yourself and train other people to speak up as well.
Things like training student social workers, training other self advocates in how to be how to speak up for themselves. You can actually go and train you can actually go and deliver sessions in schools. So sometimes you just go and give a talk because people want to understand more about disability. Hate crime and make crime, disability awareness. So that's telling people our experience of having a learning disability and why it's so difficult and how they can improve the way they interact with us so that they can actually get it right next time I have to work with someone with a learning disability.
Health training. Students also train police. Also, hate crime workshop as well.
When I was at the university, at Durham University, we did a thing with the SUST, because I did a course called SUST, and SUST stands for Service User Staff Selection Training and Development Team. And what we had to do, we had to talk to student social workers who've never ever worked with people with learning disabilities before, and we had to tell them about our stories, and I told a story about my life.
So we also do work around campaigning, so things like Molten Hall. So for that piece of work, what we did was is we organised and took part as part of a team with other self-advocacy groups. We organised a demonstration at Monument in Newcastle, and then we we went back after that and started developing training to be delivered for the staff and patients in the assessment and treatment units, just to make sure that everybody was able to get their voice heard and the staff had a better understanding of what self-advocacy was.
Involved in the men's group at Skills. Also, Geordie Voices, which would do a lot of training around the northeast for people.
So another massive part of self-advocacy is talking to other people with disabilities on what they would want, how things could be made better for them. So consultation. So we have consulted with the NHS, and we are also some of us are also part of the leader review group in South Tyneside. So we go and we try and have a bit of a conversation around why people with learning disabilities and autism are dying younger than everyone else when, you know, most of it can be prevented.
With the quality checkers, the members got a chance to go away into people's homes so we could observe what the staff were doing towards the people that lived in them homes. And if you saw something going wrong, or if you saw a member of staff treating another tenant wrong, you had to go back and tell the quality checker instructor who was involved in the quality checkers. the quality checkers is also about people with a learning disability, and they go into people's homes and they go to check the services where they live in, and what kind of activities they get up to, and if the staff are not very friendly towards them, you must, and I say you must, go and tell someone, because it's very, very important, because it's not fair if you're being nasty to other people.
Without self advocacy, I don't think I would have a job, and I don't think I would be speaking up for myself. And and actually, a massive part of self advocacy is just basically building up friendships and getting to know each other. Because if you get to know each other, then that's half of the battle. Because you'll just tell each other your problems,